My name is Professor Nick Alderman. I'm the Clinical Director for Neurobehavioural Rehabilitation Services in Elysium Neurological. My training is a clinical psychologist and I'm a consultant neuropsychologist as well. I've worked all my professional career in neurobehavioural rehabilitation. I hate to think how many years that is now, in excess of 35 probably. I've been fortunate enough to have a sort of a dual career, so working as a clinician and also as an academic. So I've been fortunate to meet some excellent colleagues at UK universities where I hold a number of positions as well as my job with Elysium Neurological Services. And I've been fortunate to get involved with all sorts of research, which has mainly been about neurobehavioural rehabilitation, so aiming to improve it, get better outcomes, design outcome measures, and really to try and ensure that the patients and the residents that we treat in our services get the best outcomes possible. And that's been my privilege and pleasure for the last 35 years. So neurobehavioural services are fairly new. So the first neurobehavioural service opened its doors back in 1978. So in terms of a rehabilitation program, it is quite new, and it's developed out of all recognition compared to that original program. And like all rehabilitation programs, it continues to evolve. The sorts of people neurobehavioural rehabilitation benefits are typically people who have had an acquired brain injury. And the research tells us that for many people with an acquired brain injury, challenging behaviour is a real issue, unfortunately. And that can be more of a long-term handicap to getting back to normal, if we can use that word, or going back into the community, than physical problems. So if we talk about challenging behaviour, people often talk about aggression, and certainly that can be an issue for some people. But in terms of the challenging behaviour that our group present with, it can be all sorts of things. It's really, really varied. Often it's just difficulties with forming relationships that people have as a result of their brain injuries, which really prevents them from accessing the more traditional forms of rehabilitation, or for families to keep them at home. So neurobehavioural rehabilitation is a program which is all about trying to improve the autonomy and the quality of life for that group, to help them be the best that they can. So because neurobehavioural rehabilitation is quite different from the more traditional neurorehabilitation, there's not a lot of outcome measures out there that are suitable for tracking issues to do with challenging behaviour and brain injury. So we've had to invest in and research and create those tools ourselves. And I think that's where my academic sort of credentials and academic context have proved really, really helpful in helping to generate these tools with colleagues in the university settings. And we've published a number of measures along the years which are used pretty universally now in rehabilitation settings, not only in the UK but all over the world. So, for example, we have an observational recording measure we call it the MOAS, Modified Overt Aggression Scale. Its real name is the OAS-MNR, which is a bit more of a mouthful. But this is a tool that clinicians use to record incidents of aggressive behaviour that patients and residents show in our programs. And it's very detailed, but it gives us all sorts of information about their aggression, but it's very quick and easy to do. So it has a lot of validity, and this can really, really help us to understand what factors drive that aggression, and to help us then create a program which can help our patients and residents communicate their needs in different ways, and for them aggression becomes a thing of the past, hopefully. And certainly our outcome studies that we've published have shown an enormous reduction in aggressive behaviour. The other measures that we've been creating are numerous and varied, but the other one that comes to mind, again a bit of a mouthful, is the SASNOS. That stands for the St Andrews Swansea Neurobehavioural Outcome Scale. And this is a measure that we use in our basket of outcome measures. So patients and residents would be assessed on this on admission and every 3 months and at discharge. And this gives us a tool really for the first time for these sorts of patients and residents, which allows us to look in detail at what we call their neurobehavioural profile. And we talk about challenging behaviour, it's people's neurobehavioural difficulties which drive that challenging behaviour. So it's very, very important for us to measure that, to quantify it, to create programs to try and help people rectify these sorts of issues and to help them to become more autonomous. In a neurobehavioural rehabilitation program, we have a transdisciplinary team. And what the transdisciplinary team does is ensures that all the therapy that's been prescribed by therapists and doctors and psychologists in timetable sessions, that gets carried out 7 days a week, 24 hours a day, until it becomes part of the habitual repertoire of the patient or the resident. That means people get their outcomes much more quickly than they perhaps would in a more traditional setting. And also, because our programs are based on new learning, every day is an opportunity to practice those skills and consolidate those skills. So a transdisciplinary team can be a really, really effective tool, essential I would say, for neurobehavioural rehabilitation, to help patients and residents get to where they want to get to much more quickly. Families are part of the transdisciplinary team. So families are consulted at every stage of the process, from day one, before day one. And families are very important agents of change as well. And of course, the support that they give to their loved ones is an essential part of the therapy and the rehabilitation that people give. So without the support of families, I think progress for our group of patients and residents would be poorer without that sort of input. So getting families on board is a very important component of neurobehavioural rehabilitation. The families know the patients and the residents very well, let's face it, that speaks for itself. So getting their viewpoint, getting their contribution to the programme is absolutely essential. And of course, for many people in the longer term, the aspiration is to get patients and residents back to the care of their families out in the community. So having families on board is really, really important because it gives a perspective on where we're going with their loved ones. They can support their loved ones and continue to do that. And also when their loved ones go home on weekend leave or for holidays or whatever, families can carry on the great work that the transdisciplinary team back in the hospital or the unit are doing. So from that point of view, they are very much part and parcel of the TDT, the transdisciplinary team. I think what's unique about Elysium's neurobehavioural rehabilitation programs are the core clinicians that Elysium Neurological have. The core group of clinicians that are now working in Elysium Neurological have many, many years of experience working in this field and are all recognised experts. And I think they're bringing the best of neurobehavioural rehabilitation to Elysium Neurological Services.